Continuing ATI Chapter 19, Oxygen Delivery Devices with Partial Rebreather Mask. With the partial rebreather mask, you want to cover the client's nose and mouth. The FiO2 will be 40 to 75% at flow rates of 6 to 11 liters per minute. Advantages are that the mask has a reservoir bag attached with no valve, which allows the client to rebreathe up to 1/3 of exhaled air together with room air. Disadvantages are that the complete deflation of the reservoir bag during inspiration causes CO2 buildup. FiO2 varies with the client's breathing pattern. Mask is poorly tolerated by clients who have anxiety or claustrophobia. Eating, drinking, and talking are impaired. And we need to use with caution for clients who have a high risk of aspiration or airway obstruction. Nursing actions would be to keep the reservoir bag from deflating by adjusting the oxygen flow rate to keep it inflated. Assess proper fit to ensure a secure seal over the nose and mouth. Assess for skin breakdown beneath the edges of the mask and bridge of the nose. Ensure that the client uses a nasal cannula during meals. The non-rebreather mask covers the client's nose and mouth. FiO2, 80 to 95% at flow rates of 10 to 15 liters per minute to keep the reservoir bag 2/3 full during inspiration and expiration. Advantages is that it delivers the highest O2 concentration possible except for intubation. A one-way valve situated between the mask and reservoir bag allows the client to inhale maximum O2 from the reservoir bag. The two exhalation ports have flaps covering them that prevent room air from entering the mask. Disadvantages to this non-rebreather mask, which is pictured here. Non-rebreather mask disadvantages are that the valve and the flap on the mask must be intact and functional during each breath. Poorly tolerated by clients who have anxiety or claustrophobia. Eating, drinking, and talking are impaired. Use with caution for clients who have a high risk of aspiration or airway obstruction. Nursing actions are that you need to perform an hourly assessment of the valve and flap, assess proper fit to ensure a secure seal over the nose and mouth, assess for skin breakdown beneath the edges of the mask and bridge of the nose. Ensure that the client uses a nasal cannula during meals. Moving on to high-flow oxygen delivery systems. These high-flow oxygen delivery systems deliver precise amounts of oxygen when properly fitted. First off is the Venturi mask, as pictured here. With the Venturi mask, it covers the client's nose and mouth. FiO2 of 24 to 60% at flow rates of 4 to 12 liters per minute via different sizes of adapters, which allow specific amounts of air to mix with oxygen. Advantages are that it delivers the most precise oxygen concentration. Humidification is not required. It's best suited for clients who have chronic lung disease. Disadvantages of the Venturi mask is it's expensive. Nursing actions are that to assess frequently to ensure an accurate flow rate, make sure the tubing is free of kinks, assess the skin breakdown beneath the edges of the mask, particularly on the nares. Ensure that the client wears a nasal cannula during meals. The aerosol mask, face tent, and tracheostomy collar. These devices the face tent fits loosely around the face and neck. As you can see here, face tent. With the face tent, it fits loosely. Tracheostomy collar is a small mask that covers a surgically created opening in the trachea. FiO2, 24 to 100% at flow rates of at least 10 liters per minute. Provide high humidification with oxygen delivery. Advantages. It's good for clients who do not tolerate masks well. They're useful for clients who have facial trauma, burns, or thick secretions. Disadvantages is that its high humidification requires frequent monitoring. Nursing actions are to empty condensation from the tubing often. Ensure that there is adequate water in the humidification canister. Ensure that the aerosol mist leaves from the vents during inspiration and expiration. Make sure the tubing does not pull on the tracheostomy. Moving on to the T-piece, which delivers FiO2 of 24 to 100% at flow rates of at least 10 liters per minute. Advantages to the T-piece are that it can be used for clients who have tracheostomies, laryngectomies, or endotracheal tubes, ET. Disadvantages of the T-piece is that high humidification requires frequent monitoring. Nursing actions are to ensure that the exhalation port is open and uncovered. Ensure that the T-piece does not pull on the tracheostomy or ET tube. Ensure that the mist is evident during inspiration and expiration. With oxygen therapy, we have indications of potential diagnoses, hypoxemia and hypoxia. Hypoxemia is an inadequate level of oxygen in the blood. Hypovolemia, hypoventilation, and interruption of arterial flow can lead to hypoxemia, low blood oxygen. From hypovolemia, hypoventilation, and interruption of arterial flow. Hypoxia is a decrease in tissue oxygenation. Client presentation would be, early findings would be tachypnea, tachycardia, restlessness, pale skin and mucous membranes, elevated blood pressure, findings of respiratory distress, which could be use of accessory muscles, nasal flaring, tracheal tugging, and adventitious lung sounds. Late findings would be confusion and stupor, cyanotic skin and mucous membranes, bradypnea, bradycardia, hypotension, and cardiac dysrhythmias. This completes ATI, page 117 of chapter 19. We will move on to the considerations on page 118 shortly.